So you've joined the Core and Pelvic Health Focus Group, learned a lot, and decided you want to see a pelvic physical therapist. You found a provider in your area, whether that be in a private clinic, hospital setting, or even in your home. You've made the call and set up your appointment, and now you're left to wonder what the first visit will be like. Sometimes the worry and anxiety of simply not knowing is enough to keep people from following through. We're here to help. We want you to know what to expect from a well-trained, competent pelvic health provider and hopefully get you the help you need. Step 1 is usually paperwork. Typically, you will be asked to fill out some very detailed forms which may be sent via email, text, or snail mail prior to your first appointment. If your intake forms are not sent ahead of time, you may be asked to arrive early for your first appointment. You will be asked questions about your symptoms, which may include details about your bowels, bladder, sexual health, behavior habits, and reproductive and medical histories. Take your time on these questions. Something you may not feel is related may be important to what is going on. Depending on your gender, some questions may not apply. Remember, pelvic physios are typically seeing a wide range of clients of all ages, so skip what doesn't apply, but give details where you can. Step 2 is talking. Most providers spend the first part of their evaluation simply diving into your story. This will involve going over the details provided on your paperwork, finding out what has worked and what hasn't, and figuring out what successful treatment looks like for you. What do you want to accomplish? Not leaking with double unders? Not having pain with sex? Being able to sleep through the night without waking up to go to the bathroom? This conversation typically takes place in a private treatment room so clients feel comfortable speaking freely about sensitive topics, not in a busy therapy gym you might expect. A lot of therapists will then take the time to start the very important education that PTs are known for. This may include the anatomy of the pelvic floor, as well as an explanation of what to expect during the physical examination. Step 3 is the physical examination. This is the part a lot of people worry about the most, but this is where the puzzle pieces start coming together for your therapist. A good PT will not simply be looking at your pelvic floor in isolation. They will be looking at you as a whole person. They will be checking posture, movement, strength, flexibility, nerve function, restrictions in your connective tissues, breathing patterns, and joint function, especially in the hips and back. So make sure you wear comfortable clothes you can move in freely. A lot of pelvic physical therapists are trained to perform internal assessments of the pelvic floor muscles. For females, this exam is typically performed vaginally, and for males, rectally. These exams are only performed with client consent and never when a client is experiencing fear or apprehension. For therapists trained to perform these exams, the findings are invaluable. It oftentimes allows them to get a complete picture of what is going on with the client. Are the pelvic floor muscles overactive or underactive? Can the client contract and relax the pelvic floor muscles? Are the muscles weak or strong? Are there tender areas that may need to be addressed in treatment? Sometimes what is seen externally does not add up with internal findings, so this part of the exam can make treatment more effective right out of the starting gate. Sometimes this exam is put off to a second or even third visit. This may be due to time constraints, client choice, or the therapist not feeling an internal assessment is necessary right away or even at all. Don't avoid seeing a pelvic physical therapist due to fear of an internal exam. A good PT always works within your comfort zone. Women always ask, should I cancel if I'm on my period? It is usually not necessary to reschedule if you are on your cycle, but if this causes you concern, definitely call your specific provider to discuss. Step 4 is typically more talking. This is where you will work with your therapist to develop a plan of action based off your specific presentation and needs. Depending on what the therapist found during your exam, they will most likely continue the education started earlier in the visit to include what they feel is going on and how physical therapy may or may not be indicated to address your specific problem. Your therapist will likely assign homework, which may include exercises, breathing techniques, relaxation techniques, bladder diaries, and even dietary considerations which may be contributing to your issues. That's it. It's a lot packed into typically an hour, give or take a little. The biggest thing to remember is that you should feel comfortable at all times. Remember, your therapist is in this field because he or she is passionate about helping people just like you. You should feel respected and listened to during your visit, never dismissed or ignored. The goal is for you to leave that first visit feeling empowered and hopeful. Taking this first step can be scary, but it is so worth getting to the root of your problem and starting your healing journey.